welcome you all on behalf of SINE for today's session. It's more of an informal session, interactive session with the program managing partner IITB Knowledge Park. Most of you must be aware about SINE. SINE is Technology Business Incubator hosted by IIT Bombay, and it was started back in 2004. And we basically handhold all the we provide start to scale support and handhold entrepreneurs, innovators, startups. Our focus is startups who can create social impact as well as technology which has IP, some kind of intellectual property, technology-based startups. And through our webinars, we bring a lot of, info. Most of the time, our webinars are on funding opportunities which are available for startups, innovators to work on their ideas and take their ideas through these programs to market or commercialize their ideas. And we host various webinars to bring awareness about a lot of funding opportunities from different government agencies. It could be DBT, BIRAC, it could be METI, it could be DST. So today we are going to discuss about one such program, that is Amrit Grand Challenge JanCARE, which is launched by the BIRAC, which is arm of DBT, METI, Ministry of Electronics and Information, NASSCOM, in collaboration with Grand Challenge India and several other partners. They have announced a nationwide Grand Innovation Challenge program, that is Amrit Grand Challenge JanCARE, which is envisioned to identify 75 digital health tech innovations in telemedicine, digital health, healthcare technologies with big data, AI, ML, blockchain, and other technologies. That could be from startups, individual companies, and the program is aligned to the National Digital Health Mission. And the program will attempt to support the various verticals of managing digital health records and patient compliance standard mandated for Indian citizens. And we'll discuss more information about this program from the managing partner of this program, that is IITB Knowledge Park. And today we have here with us today's speaker. Is from IITB Knowledge Park. I'll quickly introduce our speaker here so that he can give you more information about this challenge. You can interact with him to understand more about this program and funding support. Dr. Viswantham is currently he is managing various funding programs at IITB, and he is Assistant Vice President and Head of Life Science Incubation at IITB Knowledge Park. As I mentioned, he managed various funding program. One such program is BIG, Biotechnology Ignition Grant. Most of you must have heard about it. It's a very early stage funding for biotechnology innovations. He has also handled ICO fund, that was a fund launched for the COVID solutions by IITB. And through that also they have various successful stories. Probably Visu will share those stories with you here as well. And then there is currently he's also handling this JanCARE program. He's managing from the IITB along with his other colleagues. One of his colleagues also joined here, Harshada, for today's webinar. She'll also be probably we will resolve your queries regarding this program. As I mentioned, he is managing life science incubation at IITB and handholding scientists and early stage startup during their entrepreneurial journey. Visu is basically he's an alum of IISc Bangalore. His PhD was in DNA mismatch repair on bacteria. He was also a fellow of Marie Curie Industrial Network Program, Germany. There he worked on asthma drug development. He was also a senior postdoc fellow Jackie Woods Cancer Center, UK, and studied genomics of patients that do not respond to standard cancer therapy. So he has a background of technology, and currently he's interacting with various startups. So I request, with this brief introduction, I request Visu to please, give us as much as information about this program to our attendees, students here at IIT Bombay and other startups associated with SINE, so they can also apply to this program and get all the support from you. Over to you, Visu.
Thank you, Pranita and Brati and the SINE team for organizing this session. Pranita mentioned this is a very informal session, so feel free to start putting your queries, and somebody from the SINE team can interrupt me. So if there is a question for a particular slide, so we can stop there and discuss, or else very quickly a 10 minutes overview of the program I will give, and then from there we can take the discussions. So basically today the session is more about the discussion, and in case if you are having any issues with application. Thanks, Pranita, for giving a brief introduction about the program. Amrit Grand Challenge JanCARE, reimagining healthcare delivery. So to impact and improve the healthcare delivery in a country like India, where 1 billion plus population, we have seen during the pandemic, so we have certain constraints. So how we can improve the healthcare infrastructure? I will be talking about National Digital Health Mission, objective, and the ideas and startups objectives aligned with those will be treated on priority in this program. So the program was launched on January 26th, and the call is accepting the applications. It is open until March 31st, so we have next few days. So that's where this session is very informal to help you to complete the application. This call was launched by BIRAC in partnership with Grand Challenge, NASCOM, IIT Delhi, India Health Fund, Startup India, DBT. So various partners are there in the initial stages, and we welcome the ecosystem partners. SINE is one of them, SAAC from IIT Kanpur, VAT from Vellore, the VAT Technology Business Incubator, and PGI STEP Incubator. So I will talk more about the role of ecosystem partner and the investment partners in this program. So to briefly tell, there are 75 ideas, and late stage and advanced stage proposals are being supported in this program. The 60 are mainly in the early stage innovations, where it's a 10 lakh rupees grant, which are at idea and testing level projects. And 13 are late stage innovations, which are at pre-commercialization, paid pilot kind of stage, and 2 are supported at advanced stage, which are in the deployment stage. So as I mentioned, National Digital Health Mission and the Ayushman Bharat. So the projects aligned with those will be given high priority. So what is the priority of National Digital Health Mission? To improve the digital infrastructure of the country. So you can imagine what all can be done. So there is no restriction on any basic parameters. So feel free to propose what you think with support from the literature. So you can visit the URL there to find more details, and the call closes on March 31st. So some of you might be already aware, working with the healthcare system, there will be so many players will be involved. So when you have to take a healthcare solution to the market, so one thing is, of course, the regulatory challenge. So in this program, we envisage to work with the startups, combined with the various partners in the National Digital Health Mission. So that is where the startup solution can be taken to the next level to have a scale that can create an impact, and also facilitate otherwise obstacles for certain startups. So some startups may not be able to reach some of these partners. So in this program, we'll be very happy to extend our network to help you people. So broadly 6 technology domains. So these are like guidelines, you can say. Any digital solution you can think of will fall under any of these 6 categories: digital health, big data, analytics, M-health, blockchain, AML, telemedicine. So when you are filling the application, it will ask you to choose. It is better to choose one of the parameter, one of the technology area you think you will be using more, but you are free to choose more than one. So there are 6 broad focus areas. So it is not just restricted to these, but if you think something is not falling under this category, you feel free to suggest, and you can select the closest one that is coming under this. In our country, the rural population, so the 6 focus areas I won't be reading, but broadly the solutions, the focus will be where the healthcare delivery is in limitation. So first thing comes is tier 2, tier 3 cities and rural areas. And for community outreach, you might have seen during COVID time, we need much more awareness and involvement of the community. So if you have any digital solution that can answer this thing, feel free to go ahead. And health data collection and predictive analytics. So in most of the apps and the digital health related platforms, so once we collect the data, can we have a predictive analysis based on the incoming data? Can we forecast certain thing? Can we take this to the health ministry? Can we take it to the next implementation partner who can take action? So that is another one. And of course, digital learning in the medical field. So now many of the medical education institutes are coming up with digital courses and digital AI, VI, and AR, VR based solutions where the students can experience like real surgeries and solution to enhance patient compliance. So mainly, in certain cases, the patient compliance is a limiting thing. So they will have access to certain things. Some people may not have access to certain things. Can we address those issues? And of course, any digital solution, not just healthcare, will have privacy concerns, how data is stored, how the security solutions are managed. If you have solutions on this, welcome to apply. And of course, much larger impact, data-driven modeling that can improve the pharma and biopharma R&D in innovations. So these are the broad areas. As I mentioned, if you have something that is not coming under these areas, you choose the closest one and we'll be happy to have a look at it. These are the very broad timelines. The call opened on January 26th and presently it is open. So March 31st is the closing date. Please try to submit today or tomorrow. And August 15th, the 75 awardees will be announced and we'll start the due diligence process by that time. And we will use our partners to connect and, as I mentioned, the ecosystem partners, we have technology partners like AWS and MathWorks, the CAD software is from MathWorks. So any other these teams need additional help, the technology partners are happy to mentor them on the technology front. And they also have very generous credits for using those platforms, and the licenses to those softwares will be available to all the awardees. And the money, that 10 lakhs for the idea and the testing level is only just one of the thing. So the connect with the industry, incubators, hospitals, academia, who can take the solution to the next level. That is the biggest plus point in this program, where what I see. So don't limit yourself with just the 10 lakhs and 20 lakhs and 50 lakhs. That is just a starting step. And the investors and the other investment partners who are joining are happy to extend the follow-on funding. And many of the incubators have shown interest in looking at follow-on funding through various programs they have. So this will be an excellent platform if you have a digital health related solution, using the program to have access to all the network partners. So we'll be very happy to extend in this, and that is where the ecosystem partners will be mentoring certain startups who can be better mentored by them. So with this the broad overview is complete. I thought since most of the students are registered from IIT Bombay, so very quickly I gave set, and the first thing comes is IIT Bombay alumni, the DOSI. So as Pranita mentioned, the biotechnology ignition grant, they were supported by Virat. So DOSI is a very simple contactless sleep monitoring device. So initially it was designed in the BAG program. It's a 6 years old. It was designed where the stress levels and the sleep quality, these things can be measured initially. So when kids are away, they can monitor their parents' health, and in case of any fluctuations, when they see some spikes, are very simple. It has a very nice simple user interface, as you can see here. During COVID time, so like there were several temporary COVID wards were established, and we know very well that we don't have enough doctors to support existing hospitals. They are overworking. How these temporary, wards, just in Hyderabad, I know about at least, 300 plus temporary beds were set up. So where can we get these many doctors? Where can we get these many nurses? And I want to share one real example. Ozone Hospital wanted to set up a 100-bed COVID ward, and they were looking at all the solutions, and they want to set up very quickly. During COVID time, everything we want instantly, because that is the urgency. So many lives at stake. So time is the essence. So, when we contacted this team, afternoon we set up a call. In the morning they came and gave the demo, and by afternoon all the beds with complete dashboard is ready. So that is the kind of impact the digital solutions can create. I will just talk a little more about this. Just give me a minute. I hope you can see my screen. So
Yes.
yes, thank you. So in these hospitals, when you have to set up a ICU or a monitoring bed, it costs quite a lot of money, anywhere from 15 lakhs to 80 lakh rupees. So if you go to a premium hospital with very imported or sophisticated, basically they will measure all these parameters, but standards and those things cost quite a lot. And you won't believe, for setting up one such monitoring bed, of course this is not exactly the ICU, but a step down ICU, the Dozy team was able to do under 10,000 rupees per month. Can you imagine, like a temporary setup? You can't buy a bed because you just need for 1 month, 2 months. We don't know that time. So the hospital cannot invest like a 50 crore rupees, but they want to start it. So that is where Dozy, they can set up under less than half an hour. So in my home, I could set up in 5 minutes from opening the box to monitoring. I am the BAZ manager for the program. So when they came for the demo, so I had the privilege to use it in 2018, and very happy to see during COVID time, SpO2 levels, temperature monitoring, stress levels. And I also want to tell another example when I'm saying about, limitation of doctors, what Dozy was able to do. So now they are across 320. This is a real-time dashboard from their website. I'm displaying dozy.health. So 320 hospitals, on average 20 beds per hospital they are able to do, and they were able to do in the government hospitals. Can you imagine? So a private, a corporate hospital can do, they have unlimited resources, at least enough resources, I would say. But a government hospital has very limited resources, and it caters to the patients free of cost. So the budget is very limited. So these people were able to do in those kind of hospitals. And can you imagine saving 1,70,000 nursing hours, when we can't train somebody to become a nurse overnight just because we have a problem with COVID or anything? But how this was achieved? So let's say that they are setting up monitoring for 100 beds. There will be a dashboard which will display out of these 100, those 2 patients have the SpO2 levels which needs help from a doctor or a nurse. So the doctor is able to concentrate on those 2 patients, and during that time, mind you, even the doctors, nurses, even own family members are afraid of going near their dear ones. So this solution was able to have a very nice display outside the ward. Out of these 100 beds, these are the 2 beds that have requirement for the oxygen. They have stress levels. So you can actually Google, Dozy Madhya Pradesh. You can just, I'm sure you can reach their YouTube channel. So this is the kind of impact you can create. Can you imagine, doing something at a 1% of the cost and also saving doctors' time? So we can buy a ICU bed for 15 lakhs or 50 lakh rupees. But in this, such a simple contactless, there is no contact involved, and doctors don't have to check every minute, and the patients are very calm because they are being monitored continuously, and whoever has the need are being attended. So with this, I just wanted to very quickly look for the students at IIT Bombay, but I found an alumni example, and I know about Dozy, so I thought I will just bring this example. So this is not to tell that Dozy like solutions only should apply. So this is just to give you a feel like if you are working with digital health systems, the scale at which it can be done, the cost reduction that can be done for a country like India. Saving even 1,000 rupees is important, like beds. If you are saving lakhs, there is nothing like that. So with this, I have actually posted the URL where you can visit the program guidelines. Once you click on that link, so this is the page that appears, and you can read the program guidelines. And today, since there are more students are coming up, I will talk about the early stage, the 60 awards for the idea level 10 lakh rupees grants. So many of them are individuals. So in this program for the early stage funding, individuals can apply. Of course, startups can apply. Researchers, faculty members, there is no restriction on who can apply. Basically, any graduate in science working or interested and working with another team. So this is completely open, and also there is an option given to add your collaborators. So you might be from a different background, but if you are working with a technology partner, feel free to add them as well. So
Yes.
I posted the link in the chat box.
Yeah.
So
Okay.
that is where you can select as an individual or a company, and of course the basic details you will be filling. And here, if you're a student and you're thinking about applying the idea and the testing level project, this is very broad. So from idea to pilot validation. So you have to select the first option, and of course, number of months you are free to choose with the 10 lakh budget. And here you can apply as an individual or along with a collaborator. That is where I mentioned that in case if you have another partner with you, you are free to choose. And all these 5-6 questions you have to answer in the main one are like a free flow. So it's not like you have to update a PPT here, but you have to answer these 5 questions under 500 words. So some teams actually have submitted applications with 200 to 50 to 300 words, which is perfectly fine. So you don't have to reach 500 as long as you are able to convey the answer, that is perfectly fine. And for the idea level projects,
Visu, sorry to interject you here. Could you just explain some of the important areas where they need to fill information? What kind of information related to technology, validation, if it is, if you could just let them know.
Yes. So in the first page, that is where about your innovation. So what is the proposed idea? What is the value proposition, and what is the novelty? So these 3 need to be answered in the first question. It is as simple as that. So coming to the healthcare gap, what they are addressing, I request everyone applying must visit the National Digital Health Mission and have a look at their objectives and what are the present programs. So for example, if you are developing a app or healthcare records, I would ask you to look at their portal. There is something called, before it is called Health ID, now it is called ABA, Bharat Health Account. So previously it is called Health ID. So anybody working on these things have to need to have an understanding how you will be integrating, because we are thinking about deploying this solution at scale. And coming to the next, and if you have worked on the the project, and if you have preliminary data, feel free to describe. And there is an option to upload as a PDF the amount of work you have done. Let's say that you built an interface. So it's not about the clean UI UX, but if you are able to integrate certain components, you can include in the preliminary data, be it if you have a literature support, if you have a team. So please feel free to have a representation of what kind of preliminary work you have done. So be it we had from starting from 3 months engineering project about integrating information to rural healthcare centers to vaccine availability. So it's up to you, how much work you have done. Please present under 500 words. This is all in the text, free flow text, and the PPT or the Word file which you will be uploading will be the PDF. It will accept only the PDF. And So the other questions are mainly for the advanced solutions. So validation tests you have carried out. So if you have not carried out, you can mention what you are thinking, about validating, whether you are going to first a government hospital or a tier 2 private hospital. So for the advanced stage teams, they have to give in more detail how they have validated. For idea level, they can give how they will be doing or which test center they are thinking about applying. So this will not be coming up to 500 words. This will be a short answer, but this is open to you. So when you come to the next page, all these are for the advanced and the late stage solutions. So if somebody has deployed, what is the cost? If they have done the preclinical or in an evaluation in a hospital, what are the results? So that's why, you can see in the red, it's not mandatory for idea and testing category. But if you have done something, you can mention. But if you have not done, if you think that it is very early stage, you can leave these things. Pranita, am I clear on this one?
Yes, Visu. But just so these fields are not mandatory, where you have to upload the advanced.
Yes, these are not mandatory. So
okay.
The fields present in the red, not mandatory for idea and testing category. But if you are applying for the advanced category, yes, then they are mandatory and they have to upload the validation reports, test reports. But for idea stage, this is not mandatory. So when they are filling, it will be shown like exactly what you are seeing on my screen.
Okay, yes. Just one quick question, Visu, here is that let's say somebody forgot to upload something, or because of some technical errors, it could not be done, let's say within a timeline given. Is it possible for them to send it to something to you later on, or it won't be?
So the entire evaluation process is online. So I would urge you to save it as a draft and share with your team members. In case if there is so all the files what you are uploading will be the PDFs, and there should not be space in the name. So keep the names very simple, clinical. So in case, let's say you are uploading something, the document name can be very simple. So if there are special characters, if there are spaces, it doesn't accept. So make the PDF files with very simple names, validation, test report. So without spaces, they can create all the PDF files and upload. Without uploading, of course, for the advanced stage, if you have selected the advanced stage in the application, it will ask them to upload. It will not go to the next level. But best is to save as draft and ask your team to very quickly review before submitting. This entire process is the online process. Yes.
Sure, Visu. So I think that key message here is to upload. Please try and upload all the attachment because it's an online review process. That is the message here. Thanks.
Yes. Most of the things I mentioned, of course, Dozy, I was excited and I took them to the website. But yeah, this is now it is open to the discussion, and we will start looking at the questions.
Okay, thanks, Vesu. I'll request all our attendees, if you have any question, please raise your hand so we can unmute you and you can ask your question to Visu directly. Meanwhile, there is one question in the chat box, Visu, from Saurabh. He's asking, is it possible the pre-commercialization fund can be converted to soft loan, or will there be a compulsory equity component? With this question, actually, I'll request you to, could you explain about these funds like DIG, there are royalty later on when you make a product commercialize or something. If there are equity, kind of a components for the seed and leap kind of a fund. But this fund, what are really, could you tell us about all these components?
Yes. Yes. So there are three types of awards are there. One is for the early idea stage, that is a pure grant of 10 lakh rupees. And you will be working with an incubator that will help you to take it to the next level. And for the second and third, late, advanced, and late stage deployments, that is an equity. So we have investment partners, so who will be investing in these companies, and that will be equity against the value of the company. So in the application, it was mentioned as up to 5%. So many people are thinking it is so it is up to 5%. So if the value is, let's say, 50 crores, then for 50 lakhs, it will be 1%. So feel free, and you will be given an option. It is not royalty, it is an equity, and there will be investment partners. And as I mentioned, the first fund is only to see that, first 6 months, how this is being done, and there will be a very quick follow-on support will be there. So be it institutional investors or the investment partners in this, it will be open. There will be also a demo day where outside investors will be invited. So that will be against the equity and against the valuation.
Oh, right. So it's overall a good opportunity where you're going to get exposure at such an early stage to these investors. Just one point here is that it's not just equity which or funds which you'll be getting. These are the inputs from the investor when they come in, come at right stage. They bring a lot of values to your startup, not just fund. So that is something very interesting here for this, I think, program. Pushkar here, I think, have some query. Pushkar, you can unmute yourself and ask your question to Visu. Yeah, Pushkar. Yeah, Pushkar, go ahead.
Yep. Thanks, Pranita, and hi, Vishwandam sir. So my question is, like, actually, I have two ideas. One idea has been validated by Harvard, which I'm going to submit. So, like, can I submit like two ideas as well? Because I have some like other idea which will fall under like the new idea. I mean, the 60 whatever the applicants category. So, first question is, can I submit it? And second question is, if yes, then what, like, are there any key factors or stuff that you will be looking for?
So if you have already created the account, if you log in, there is an option. So when you are filling the form, open another application. So create a new application option is there. So you can submit two as well. So if you are on the portal, I would request you to just quickly check, and by clicking that new option, it will create. I would say that maybe you should submit the first one and then open the second form, so there is no confusion. And
Okay.
whether you submit one or two, each will be looked at individually, separately. So you will not be given a benefit of doubt that you submitted 2 or 3 ideas, let us give one. It won't be like that. Each will be treated separately.
Got it.
And one more suggestion is, yes, please give me another minute. So when you are submitting multiple things, they would be looking at whether there are enough people on the team to execute. If you are an individual, panel might be thinking it might be a challenging thing to do these two projects with limited budget. Even if two are funded, it will be 20 lakhs, and if there is only one person, so I would say it is better to look at the team. So they would look at the team. So when I'm receiving the 2 or 3 applications, very good ones. So many a times, in other similar innovation grants, usually the applicant will be given a chance. If 2 are excellent and there is only one person or a very small team, they will be given a choice to choose if both are exceptionally good.
Yeah, makes sense.
Pushkar, I think also mentioned one question. Is it okay to submit some files later around April 15? You still have that question?
Oh, yeah. Yes.
So they are asking for submitting, files later in case, probably in worst case or something.
Pushkar, I would say that the application deadline is March 31st. So I had seen few applications. Some applicants are very clever. So what they have done is they have given a folder link. So where the applications will go for review by April 15th or 20th, and they are able to update there. So I will leave those things. I will not tell those tricks, but you can give if you have a website or something where those details can be updated by you. So I cannot send them anything, but you can do it.
Perfect. I mean, the reason I asked this question was like I did look at the website and it says like when there's some time, like the breathing space for you to review. So I just intended, but you answered it. So it's
that
perfect.
is where the students are much more clever. I was really surprised when they mentioned about URL, and in the PDF also they are able to insert that link. So if the reviewer clicks, it opens and that video or that folder. So I felt that's a very clever idea. So they are taking that 15 days time. But if you reviews on the first day, which usually doesn't happen because we also need some time to look into the eligibility, and you have seen there is a 15 days time is there. But I will leave those options to you to exercise. Yes, you can be smart and use that option.
I think, but Pushkar, what I'll suggest is that we should rely on such things because it's a good chance, right? It's good opportunity. Should not lose the opportunity just because you were not uploaded things in time or something, or maybe that time URL doesn't work or there could be some issues while that didn't happen and they did not have any
Yes.
review. So, try to upload and
Yep.
it as soon as possible, right? Within time.
Right. Yep. I just asked it because I just wanted that Delta stuff because
Yeah.
I'm in the US right now.
Right.
So the time zone and all, it's like this. But
Right.
again,
So you are
thank you, sir.
behind, right? So you have 10 hours, 12 hours extra than us. So that way you.
Yeah. Oh yeah, you got it right. So
Yeah. Thanks, Pushkar. I think we have
thank
another
you.
question from Karthik.
Thank
Karthik, please go ahead with the question.
Yeah, I just wanted to have a bit more clarity on the equity part of for the second and third stage. So I wanted to understand whether it will be a co-investment for the 20 lakhs and the 50 lakhs, or would it be solely done from an outer investor or any other firm for the second and third stage?
Okay. So the first level of investment will be coming in the pool of investment partners approved by BIRAC. And that will be followed with a follow-on funding that will be open to any investors. So after the demo day, other investors can come in. The first level will be a pool of investment coming from the BIRAC approved partners. So,
okay. So BIRAC will be approving some partners, and when will this particular process or the whole phenomena will complete? Is that a stipulated time that you have suggested of around August, or will it take some?
So by August 15th, the final selected teams after basic due diligence will be announced on August 15th, and they will be given another 10 days time to look at all the arrangements, and you will also have to submit the valuation, because sometimes there will be certain mismatch. So you will be given some time to present your case as well.
So post that, there will be another pitching round in front of BIRAC associated investors.
No. So the list will be, the BIRAC will decide a panel, and that will happen in the July. So the final due diligence and the August 15th, the final list of teams will be announced.
Okay.
The pitching will happen in July, and there is no separate pitching to the investors.
Okay. So those investors will have any. So how will be the investors related to the domain in which we are working? How will that shortlisting be done from the startup side, or will it be only solely towards the BIRAC end only?
So this will be done from the BIRAC and implementation partner side, and they will be given options to prevent any bias. Okay. So they will choose let's say top 20 teams, and a independent committee will be assigning these things. Okay. There will be back and forth initial discussion, but there will be guidelines who will be assigned. So all the shortlisted teams will be receiving, applying for the late and advanced stage, these guidelines, and they will be given some time.
So we will be also provided the list of investors who will be coming in for us, or I just want to understand that.
Yes, it will be updated to you, and it will be informed. Total number of investors will be there on the portal. It will be updated. After the call closes, the final list of all the ecosystem partners, technology partners. So we are reaching out to multiple levels. So all these final names will be there, but who will be assigned to you in terms of technology? Who will be assigned to you in terms of incubation support? Who will be assigned in terms of investment? These names will be coming to you individually.
Okay. Okay, sure. So it will be assigned from the BIRACs, and only the startup won't have any say that I want this particular person to be the investor, because when we look at such type of investors, we look at more towards the partnership association rather than just the investment. So
yes,
for that perspective,
yes. So so there is a ranking that will be decided. So if you are the top one, you will have the choice, and they will have choice.
Okay.
So in the ranking category. So, okay. But if you are somewhere, let's say second one, and the investors can always, these are not like a very strict guidelines that they cannot invest. So outside this program also they can invest. So okay. Let's say that the investor likes certain startup and they were assigned another startup. So they will have enough freedom within their organization to come to you. So this is a platform where they have a fixed commitment, and at least that much of contribution will be given, and the investor and startup at a later point and outside this, they can take it forward, right? That's how this is a initial facilitation where you will have access to all the networking and the technology partners and the investment partners.
Sure, sure.
And I will be happy that you are asking these, and we can share those things after closing of the call.
Okay, sure. And another thing, I just wanted to have a structure of a clinical study as to what all will be the chronological guidelines that I need to follow, or the steps that I need to follow for a clinical study or a clinical
I think,
research.
Karthik, we can take that question
Yeah.
offline as well, because this webinar is basically for, this more detailed information about this program. So that is something very general, which every startup has to follow, and that we can also take up offline. Is that fine, Karthik?
Okay, sure,
Yeah.
sure.
Yeah, thanks, Karthik.
Thank you.
Uttara, please go ahead with your question.
Hi, Dr. Pranita, do you hear me?
Yes, yes.
Yeah, hi, Dr. Vishu. So I am an academician, and I don't have a startup, but I am applying for the ideation stage program. I have two questions. So when I apply, I see that it is actually a mandatory for 6 months only. So this particular grant is going to be given for 6 months only, right? So if that is the case, then what is the deliverable that they expect us after 6 months? Because there's a question where they are asking that they want to know what is the deliverable in 6 months to 1 year. So do we have to precisely tell them that after 6 months, is it just going to be taken for the validation stage from the ideation once it's completed? And if not, then what should we really specify in that particular column? And like the BIG grant, is it mandatory to have or start my own startup after completing the 6 months? Or how is it that this particular challenge will be taken care of?
So the achievables, like deliverables, are 6 months. Please be specific. What you think at this point of time can be achieved, you are free to go ahead. So after 12 months, that is more about what you are planning to. So the call doesn't say that you have to start the startup after receiving the grant, but most people would like to start, because the people who are receiving the 10 lakh grant, if they have to be eligible for the later on investment, certainly they have to have a company, but that's not like a compulsory option that you have to start the company after receiving this 10 lakh grant. But we would like them to receive further support and start the company.
Yeah, because my idea was that after, if a person who has been given this particular award, after 6 months would be in a position to really apply for a bigger grant, wherein the entire study can be completed, which could be taken for a startup, opening the startup of my own. So this is just a very brief part of the whole project, which I have in my plan that can be validated in 6 months.
And exactly. And you also mentioned about bigger. It's not bigger. I think BAZ kind of grants can be applied,
Yes.
after showing
Yes.
this validation.
Yes.
And let's say that, you are part of National Digital Health Mission related activities, or you develop, certain things. So this preliminary data and the data developed here and the network will add a huge value. If not BAZ, there will be many more such, grants and schemes. And, I want to mention about, this is not relevant to this program, but Samrud, by USAID and the PSA, Prime Minister Scientific Advisor Office, is actively involved. So this is about impact investment. So if you have solutions that can improve the healthcare delivery, healthcare related things, so that is one of the very nice program.
Okay.
So
okay.
I will get connected with you on that one separately.
Okay. Yeah, sure. Thank you. Thank you.
Vishu, as a follow-up to the question that Professor Uttara just asked, in the question and answer box, there is Saurav who wants to know that the pop-up says it's 6 months. And so whenever they're filling out the form, 6 months is the only option that they get, right?
Yes, 6 months.
Okay, all right. Just one question from my end that came from an innovator who's also applied for BIG. If an innovator wants to apply and has an agri-tech company, however, a solution that is suitable for this challenge, do they have to apply through the company, or can they apply as an individual and later on form a more suitable company for this particular solution?
You mentioned as agri-tech.
Yeah, he has an agri-tech company. He wanted to open another firm, to apply for this, but he doesn't have the time right now. So his question is, since the
So
individual mandate,
he doesn't need, yeah, just, very simple. He doesn't need to apply from another company. He can apply from the same company. And there are some, food and nutraceutical related ones they have applied. So there is nothing to do with the company per se. This is more to do with the project. So I would say that, you should not be starting companies for a project. I think, first you should be focused more on the project.
But isn't it that company scope will be decided whether you'll be able to take up that product later on and will be able to distribute or work on that product later on? Because, the company document specifies, right, what domain.
Yes. So, yes, Pranita. So I think AOA, MOA can be amended, and if there is a provision
later on,
and, if they want to pursue full time, they can do that one. So that is much more simple to amend the, company AOA, MOA with the additional things if they are planning to take up, rather than starting another company just for this project.
But like big Vishu, if they are a shareholder in any company, then they cannot apply as an individual, right?
Yes.
Okay.
So here they have to apply from the company. So if they think that they have a agri company, they can, means if you ask me, it is better to apply from the company point of view. And if AOA, MOA is not allowing, they can apply as an individual instead of opening another company. Because there is a provision to consider, they can mention, and during eligibility check or something, we will reach out.
Okay, thank you.
So best is to just send an email saying that, we have an agri company. We don't want it to apply on behalf of the agri company. We are applying as an individual, is perfectly fine. So we don't want too many restrictions at the idea or, the testing level where students will be applying for these projects. So the scope was intentionally left very broad.
Okay, thank you.
Okay, then Vishu, when you mention about student, let's say anybody for BIG, there is a graduate, there is a qualification criteria, graduate. Here, is there any criteria?
So in the team, at least the PA should be graduate. So most of the places it is either MTech students or such people, or at least in the places where we went. So always at least there is one faculty member or a MTech student who is taking the initiative forward. The other students are part of the team. Right. So, and if there is a, let's say it's a company, then the PI has to have a stakes in the company or any such eligibility criteria. So here there is no such things are there, because this is a 10 lakh grant we are giving, and okay, they are open. So any employee of the company feels right, they have to give a letter from the company saying that they would like him to be the PI. And okay, then I have follow-on question to that. Let's say anybody pursuing BIG at this moment, okay, they already got the grant, but there is some component on which probably they feel that, the other part of their problem could be solved with this grant, with a small fund. I already got a fund, BIG, whether I'll be able to apply for this as well? There are 16 teams have applied, and it's very nice to see that they have worked out 60 to 70% of the component that they're applying for a very specific one. The short answer is yes. Okay. So actually, I reached out to all the digital health startups whom I know, and many are applying for a very particular thing. So if BIG is giving money for certain objective, they cannot apply for the same objective, even if it is 10 lakh rupees. So they have to specify what they have developed in the BIG project, and here what they want to develop. Because the 10 lakhs money, they should be very clear what they are going to do in the 6 months time. Right. This is then such a good option for people. Yes, for the BIG digital health teams, they have actually, they are the first ones to apply. So yes, as soon as this came, because they are very clear, like, they are looking at reaching out to, ministry, healthcare providers. And in this platform, actually, they are not looking for the 10 lakhs. 10 lakhs is a bonus, but they are looking at the connect what they will be getting. I think this is an excellent opportunity for those BIG teams. I would request you also, just in case I know there are some healthcare startups at SINE and
Right.
reaching out, so you can just reach out to them.
Yeah,
The
definitely.
application form for the BAG teams is very simple. They are like, they just filled and they directly submitted and sent me saying that we have submitted this thing.
Right. So I think this point was not really clarified earlier. So, but definitely we'll ask them to apply here as well. There's one question for your late stage startup. Where you are going to support, let's say 50 plus or 50 lakhs or something. So what kind of startups stage of startup you are considering there? Someone who has already commercialized something, but at very initial, or maybe you say pre-revenue, will they be eligible for this as well?
So pre-revenue will be for the middle one, so 20 lakhs one, and for the 50 lakhs, somebody who has deployed. As we mentioned, the 75 is the lower limit what we are aiming for. So let's say if there are more applications are shortlisted, because the investors will be part of the selection process, they can always extend to more people.
Right. So definitely then we have more startups who could be eligible for this and can be screened at your level.
So this is just to take them to a national level and take them to the next step. And I'm sure once, if you look at the case of Dozy, they raised 139 crores from the BAG to now in very short time. So there is nothing, you should not be looking at this 10 lakhs or 50 lakhs as the end point, but this is just a starting point. So if you are selected, that is I would consider it as a bonus for going into the next level and connect with the ecosystem.
No, this is a validation. I mean, a lot of investors also says anybody who's gone through BIRAC programs, BIG kind of a thing, SIBRI, PACE, it's a validation for them in terms of technology. So that's an advantage here. There is one question in the chat box, Visu, idea on drug development will be considered for grant.
So in the focus areas, there are 6 areas. So anything that helps in improving the pharma and biopharma R&D innovations is a part of it. There are few proposals received on the developing the drug development pipelines. So feel free to submit.
So then it has to be a kind of a simulation kind of a platform for drug development or something?
Some are purely simulation, some are simulation with a wet lab component, but only simulation component is also welcome.
Got it. There is one startup in our network. Sorry, I'm actually asking a lot of questions. This came from startups when they were interacting. Probably they couldn't join here for today's session. But like one startup is working on, monitoring the regular parameters like BP and then sugars and all that kind of a thing. But it has AI and all that for further analysis. And it is a remote monitoring kind of a thing. Probably, aged patient or your parents, which are really old and you are not able to, stay with them. They're somewhere else, and because of work, you're somewhere else and you would like to monitor them. So this kind of a solution will also like fit into this, right?
Yes, I think, home care will be a very important thing. After COVID, we have seen, monitoring the parents or, patients in general. For the doctors and also for a family, this is very important. Now all the work from home is shifting to work from office and all things. These startups which are having the monitoring from home or continuation of the care, once they reach home, will play a very important role. Yes, they are eligible to apply, and they will receive a lot of traction coming days as well. Also I'm talking from the investor point of view.
Right. Of course. So I think we would also like to, invite you one more time, probably because you have given us so much information and that really clarified some of our doubts as an incubator. So, who are really, this program is really applicable to whom and who can apply and all that. Probably we have many more startups and innovators from IIT Bombay. So it could be one more virtual session, maybe next week, early next week somewhere. If we could do that and resolve their queries, questions, that'll be really helpful. Basically.
So you are free, like, we don't have to announce a session or something. We can have like 3-4 teams. Harshada was just talking to Pratati. So we are very happy to have a smart one-on-one interactive session as well. So we can very quickly resolve those issues.
Yes.
And, yeah, you don't have to even ask.
Yeah, thanks, Lisa. Thank you so much. I think with this, we are like, it's already noon, and I think we have come to the end of this session. But probably if there are any more questions or something, I request all our participant attendees to write to us, or you can also write to IKP for implementation partner for this program. You can get in touch with us. You can come to SINE office. We can discuss your solution, and we can connect you with the IKP team for more information about this. I think there is one question from Rahul Bajaj. He's our incubating. I'll just take that question and probably then we'll wrap up. As
Sure.
telehealth can be purely cloud-based application, is there any bias for hardware solution or cloud platforms are equally looked at? So hardware solution or cloud platforms are equally looked at.
Okay, Rahul, there is no any specific bias. So this is only, the panel will be looking at the outcome, what you'll be creating, rather than whether it is a simple device or a simple cloud. Though this is for the digital health, and we all understand that, most of the digital health platforms will have a hardware component. There is no preference for just cloud or, cloud with a hardware kind of thing. So
Right.
all are, everything will be looked at individually, and more about, whether can it reach the scale, can it improve the healthcare delivery system overall. So
Right.
no bias.
I think I have connected Rahul with Harshada and you over email. Rahul, if you have any question, Harshada has already shared her number with you, so you can get in touch with her as well as you can discuss with us. I think with this, I'll just wrap up this session. It was really helpful. So it was very, I mean, the detailed information which you provided about the program, we were not really aware about so many other points. And this where I feel that the the criteria for applying qualification criteria and other criteria, eligibility criteria is not that it's not like other programs. It's very, very helpful for the startups and innovators so that they can really apply and taste their ideas with this small fund, which we always used to talk at different platforms with different TP programs and all that, where we were used to do brainstorm where how we can help these people who are not able to we are able to support with other BIRAC programs. So this is such a good initiative where we'll be at least able to give them an opportunity to work on their ideas and come to a stage where they can apply to other programs. So thank you so much for giving us so much information to us as a SINE as incubator, but to our attendees and participants from IIT Bombay and other startups. Thank you so much. And we, as I told you, will again get in touch with you and Harshada for more information if there are any specific queries coming from startups. And thank you all. Thank you for your time. And
thank you, Pranita and Bharati, and we all are friends, and we'll be very happy to help any science students, any early stage startups. So our objective is same. So though we are separate entities, there is no distinction between us. So very happy, and just they can reach out to us. And I request whenever you are mailing from SINE, you can just put Pranita, Bharati, or SINE in the CC so that they know what we are doing, and will be we have a very healthy and open relation, and we don't distinguish whether it is our startup or their startup. So feel free to. Many a times startup have this hesitation. I am from this incubator. So we both are actually virtually together. So feel free.
Yeah, we all are we work in this ecosystem. We are connected with each other, and we have to work collaborate with each other, work with each other. So there is this understanding. So please do get in touch with us or IKP for this program. Yeah, thank you so much.
Thank you, Vishu. And from my end, I really thank you for that form and how you've simplified it. I'm sure it makes the application process much more easier. Thanks a lot.
Thank you.
Thank you, Harshada. Thank you, Vishu. Thank you.
Thank you.
And have a great weekend, everyone. Thank you.